I'm sorry, everyone. I think my computer is now cooperating. All right, so Tanya is here. Catherine Diaz. Okay, Catherine is here. Sally is here. OC is here. Emily is here. Is Jay here? Don't see Jay. Wendy's here. Oh, fantastic. All right, so we have 1, 2, 3, 4, 5, 6, 7 out of 9. That's pretty good. In terms of our agenda, Dr. Yoon is with us. And Pauline is with us. Julio reports he has a personal emergency. He may not be able to join us. Janelle is here. Diane, do I see Diane? I see Diane, right? Yes. From the Nurses Association, we have Nicholas Artur. And 2 associates of yours, have they joined us?
They haven't joined yet. Jacqueline Vanacore should be joining soon.
Jacqueline is joining us?
Jacqueline Vanacore is one of my colleagues. She should be joining shortly.
Very good.
So she would join at a quarter to 7.
All right, that's fine.
I also wanted to note that Dr. Christian Branyan is here. I think he's also called Dr. Liv Yoon on the panel, but he is here as well. I will be presenting, but we will be doing the Q&A together.
So there are only one of you? There's only one Dr. Liv Yoon, and Dr. Branyan has stolen your name?
I mean, I don't think that was, I don't think he did that on purpose. I think he signed on and then he was assigned that name. So the other square that shows my name is actually Dr. Christian Branyan.
Not you. Okay, all right. Well, we're playing this.
He can still change his name. I'm not sure if he's listening.
Oh, I guess we now know which one is real Dr. Yoon. Okay. And I guess that covers everybody. All right, very good. So we're calling the meeting to order at 6:40. Our first presentation is on extreme heat, social inequities, and health in Washington Heights and Inwood. And Dr. Liv Yoon, postdoctoral research fellow at the Earth Institute of Columbia University, is going to has a presentation to show us. Dr. Yoon, go ahead.
Great, thank you. Let me share my screen here.
Oh, you know something? Hold on. Before you begin, could you go back a moment?
Sure. Oops.
So I don't know if I sufficiently announced the committee members. So the committee members who are present, myself, I'm the chair of the committee, Steve Simon, joined by Tanya Bana, Catherine Diaz, Sally Fisher, O.C. Kamina, Emily Marte, and Wendy Pena. And so 7 of our committee members are present. Welcome everyone to the meeting of the Community Board 12 Health and Environment Committee. Thank you for joining us. And now, Dr. Yoon, I'm sorry I interrupted you. Go back to your screen.
Sure. All right, can you all see my screen and the actual slides and not the notes? Great.
Yes.
Okay, perfect. Well, thank you for having us here. So I am presenting on behalf of both myself and Dr. Christian Branyan, who is a co-investigator with me on this project. So I'm gonna talk about extreme heat and associated inequities and health in Northern Manhattan with a specific focus on Washington Heights and Inwood. It should be about 10 to 15 minutes. So just a very, very brief intro to urban heat island effect. What it means simply is the phenomenon of cities and urban centers being hotter than surrounding rural or suburban areas. So this effect dates as far back as the 1880s, when people noted temperatures in London, for example, were higher than in surrounding areas. This effect not only occurs in the day, but it's also at nighttime when our bodies need to cool down to recuperate from the hot day. And the difference can be even starker at night, actually. So urban centers can range as much as 22 degrees warmer than rural areas nearby at nighttime. And the higher temperatures are due to higher absorption and trapping of heat. So from things like, having more asphalt, concrete, brick, dark roofs and pavement, tall buildings being densely together, high traffic, carbon emitting infrastructure, and just many people using energy in an urban center. That said, the important fact is that some neighborhoods are more affected than others by extreme heat. And here's what that looks like. So in New York, about 130 people die from extreme heat-related causes since 2010. And that is projected to increase up to 3,300 by year 2080 if things stay on course as it currently is. But the thing is, 50% of these deaths are in New York City's Black communities, even though they only account for 25% of the population. So clearly some populations are very much disproportionately affected. And this heat vulnerability index map really shows that. So this is a map where neighborhoods are scored from 1 to 5 on the risk factor. So 1 being the lowest and 5 being the highest. They're assessed by 4 things considered most important social and environmental factors that contribute to heat risk: surface temperature, percentage of residents who are considered low income, AC possession, and lastly, access to green space. And New York City is a really useful case to explore the urban heat island effect and its associated inequities, because there are such stark differences even within such a small geographical area. And this shows that there are other factors at play besides density, height of buildings, the color of rooftops, all the physical dimensions that I mentioned in my previous slide, which are often considered contributors to urban heat island effect. So in other words, this is New York City is a prime case to demonstrate the intersecting and compounding and cascading issues that both contribute to and exacerbate extreme heat-related risks. So these photos speak 1,000 words. The Upper East Side, as you know, a very affluent area, lots of tree canopy. Compare that to Northern Manhattan. This is Inwood. You don't see much shaded area here. It's very much traffic heavy. So there's a stark difference. I mean, these are just the physical factors so far, but even so, there's a stark difference. And also, if you look at heat hospitalizations, this is Washington Heights, this figure. They are, 1.7 compared to the 0.8 average. That's more than double. So there's a stark difference here in heat stress hospitalizations. So what we did, Dr. Christian Brandon and I at Columbia, we took on a project to literally map heat in order to make heat visible and also its disproportionate impacts. So this was part of a multi-year nationwide campaign, part of the National Integrated Heat Health Information System, which is jointly developed by NOAA, so National Oceanic and Atmospheric Administration, and the CDC. Also partnered with CAPA Strategies in Oregon, which stands for Climate Adaptation and Planning Analytics. And New York last year was one of 12 cities participating in last year's nationwide campaign. And the aim was to get a more granular look at urban heat island effect in New York City and the differences between neighborhoods. And we partnered with South Bronx Unite because our project area actually included both Northern Manhattan, so from actually 59th Street up. So we could look at the Upper West Side, Upper East Side, and Central Park as a comparison, all of Harlem and Washington Heights and Inwood, as well as South Bronx. That was our whole project area, and I'll show you a map afterwards. So we partnered with South Bronx Unite as our community partner. So what we did was we first asked South Bronx Unite to partner with us, and I had already had a relationship with them from previous work that I'd done. And we already knew that Northern Manhattan and South Bronx were hotter areas. And we actually reached out to multiple organizations, including We Act, actually. But we knew that South Bronx Unite already had initiatives going around advocating for more green space along their waterfront. So this was a really good fit. But they weren't the only community partner that we got information from. So we asked other environmental justice groups, but also community boards actually. So we reached out to this community board as well as 9, 10, and 11, because that's the areas that we were interested in, to tell us which are areas of concern. So, specific corridors of activity. What are the intersections where a lot of people are at? What are the areas that we should actually be focusing on? As researchers who don't, well, I lived in Harlem, but people who have lived here all their lives know much better, right? So we wanted to harness that knowledge. And then we were in conversation with NOAA, and then we selected a date, July 24th, 2021. This was a Saturday. And then that day, people went out. So we had about 40 citizen scientists. So these are people who live in these areas who are impacted by this. And we had compensation to pay them. They went out and collected data 3 times a day. So at 6 a.m., 3 p.m., and 7 p.m., there would be 9 pairs going on 9 different driving routes, driving for an hour, collecting data. We had a cyclist, and this happened 3 times a day. So we got over 42,000 data points, and all of this will translate onto a map, which I will show you. And these were the sensors that were used. These just fasten onto your car window and you shut it. And they fire off every second to capture block by block differences in heat and humidity. And I mentioned a citizen or community science focus. So we had local residents of these disproportionately impacted areas collect the data with compensation. And the reason we did, a good example of the reason was that some qualitative knowledge that's so key to this. So for example, we can look at a Google map and count the number of parks. But from that, we're not going to know that some parks are just concrete slabs with a swing set. And that's not that helpful in mitigating heat. That's not a park that parents are going to want to send their kids to. And that's the type of knowledge that only local residents can give us. And here's some more photos from the day. And I want to acknowledge that Dr. Melissa Barber from South Bronx Unite was a key organizer in making all of this happen. So here are the resulting maps. So this is the morning map, afternoon, and evening. As I told you, there were 3 different coaching periods. So as you can see, Northern Manhattan, South Bronx are much hotter than the Upper West Side, Upper East Side relatively, obviously Central Park. And look at these areas along the water where there's a lot of highway traffic, major roads, much hotter. The thing is though, we already know which parts were hotter. The trouble is that the parts that are hotter also tend to be poorer neighborhoods with more people of color. So not only is there inadequate infrastructure, so more traffic, less green space, all the built environment factors that contribute to the urban heat island effect, people who live in these areas also have way fewer buffers against extreme heat. So they're more likely to work outside, have less access to air conditioning. They're more likely to be in public housing that actually are notorious for absorbing and retaining heat. They're also more likely to have pre-existing health conditions that make them more vulnerable to heat stress and are also less likely to have access to healthcare. So all of these overlaps, they're not a coincidence. And that's where this is the connecting the dots piece that our project really would like to do well on. Why is it that these people who live here are rendered more vulnerable to these risks? What's the link here between heat and social and political and historical context? So I'm going to show you now a series of social, environmental, and historical factors that contributed to these disproportionate impacts. So one example is redlining. So this is a residential security map from the Homeowners Loan Corporation from the 1930s. So the areas that are lined in red were deemed high risk, and these are namely Black neighborhoods. And they wouldn't get mortgage credit. And this to this day has lasting impact. So compare that to the heat vulnerability index map. So look at the areas that are hotter and the areas that used to be redlined. There is an overlap here. And needless to say, these communities to this day remain low to moderate income communities of color. And another factor, So this is income, and the colors are inverse here. So the lighter colors indicate lower income. And again, there's an overlap here between the lower income areas and the areas that are hotter. And I know this is a lot, but I will break it down. This is from the New York City Environmental Health Portal. What factors affect heat vulnerability in your neighborhood? So the first square here is Inwood and then Washington Heights North, Washington Heights South. But what I want to draw your attention to is the poverty levels here. So because, if you look at temperature, 97, 94, 95, it actually says lower than most New York City neighborhoods. And that might be because, Fort Town Park, you actually, in terms of green space, Washington Heights actually has more than most, or in the middle of, slightly less than. Air conditioning, it's kind of on par on average, but poverty levels, it is definitely higher than most New York City neighborhoods. And that really matters because that's what's going to buffer you. That's a huge buffer against extreme heat and associated effects. So also another huge example of something that is exacerbated by heat and that also contributes to having worse risks from it is health disparities. So people who have diabetes and hypertension, for example, specifically, these are two of the most prominent health conditions that make you more vulnerable to heat-related risk, but also make it harder for you to recover from it if you get heat stress or heat stress-related illness. And again, the areas, Northern Manhattan, Washington Heights, Inwood, South Bronx, Harlem, much higher, and also they are the areas that are hotter. And if you look at health outcomes, so this is for Washington Heights and Inwood, you can see that you have a lot more heat-related emergency department visits and more people with pre-existing conditions like obesity, diabetes, and hypertension, which are significant factors for heat-related illness. And air quality and asthma is another important layer to look at because heat and air quality, heat and air pollution make everything worse. So high heat and smog and poor air quality all reinforce each other, triggering asthma symptoms. The people with asthma experience asthma flare-ups in times of high heat and humidity. And extreme temperature can cause air to become stagnant. So, air not moving is just trapping pollutants in the air, which can also cause asthma flare-ups, which cause your airways to swell, making it harder to breathe. And the South Bronx, for example, the Mott Haven, Fort Morris area is called Asthma Alley because they have one of the highest childhood asthma rates. And Washington Heights and Inwood is not far, as you saw from the previous slide. And if you already have asthma and you live in a hotter area and you have less access to healthcare, all of this contributes to you being put at higher risk. And yeah, so this shows the rates for Washington Heights and Inwood. You can see that the emergency department visits, especially for children, is much higher. And these are some other characteristics of other factors. So, older adults living alone, but also home maintenance. This is a big one. So if you live in dilapidated housing without adequate infrastructure to buffer you from heat, that's going to be a problem. Also built environment, less access to tree coverage, to tree canopy, but also traffic density. Like all of this, the point is that it contributes to the things that I just talked about. If you have higher traffic density, you're going to have more higher air pollution, which makes existing asthma rates worse, makes you more vulnerable. And all of these are compounding effects. So what can be done to rectify heat inequality? There are things like more trees and vegetation and green spaces and having lighter color rooftops, having the buildings more spread out that are helpful. And when these mitigation measures are deployed, they should be done equitably, meaning that they should be done first in the communities marginalized along race and class lines, which are significantly more affected. That said, we need to remember that heat-related inequality can't actually be addressed only through targeting heat. I know that sounds counterintuitive, but consider, for instance, that the people in areas more vulnerable to heat risk are also less likely to have access to healthcare. They have more pre-existing conditions that make them more vulnerable to heat risk. So we need a holistic approach that goes beyond temperature and humidity. But of course, mitigation is important and the need is immediate for things like cooling centers, more shaded areas, and also for more social resilience measures. So for example, neighbors and community members doing wellness checks could significantly reduce disproportionate hospitalizations and deaths. And the city is boosting its response to extreme weather events by providing ways for residents to keep cool and ensuring people know how to access them. But to save more lives, as climate change makes the problems much worse, the city will have to undo decades of urban development that has put many communities of color at risk in the first place. So I will end it there and happy to answer questions with Dr. Christian. Thank you.
Thank you, Dr. Yoon. Would you be able to send me the PowerPoint? I'd like to circulate it to the committee members and have a chance myself to study it more closely.
Sure. Yes.
And I may have to get back to you with some questions as I do the minutes. So I would appreciate your helping me out. What I did see on one of the earlier slides was it looked as though, and I think it was indicated a bit on the others, was that Washington Heights and Inwood seemed to be at lower risk. It had a lighter yellow color, I think, than other communities, especially in the south.
Yeah, it looks like it was the first map that she showed. We were one.
Right. Yeah. We were in category number 1. But then as you went on in the PowerPoint, it looked as though maybe we weren't really number 1. I don't know how do you mesh what that number 1 slide said with some of the later slides?
Yeah, for sure. So I think there are various measures to look at this. So, if you look at things like green space, as you saw, it actually, Washington Heights and Inwood actually fare much better than average amounts of green space elsewhere in New York City. But then if you look at
I think we have about 600 acres of parkland.
That's, yeah, exactly.
So we're much better off than I think most of the other communities, probably all of the other communities that you studied.
Yeah, I mean, especially compared to the South Bronx, which has been our other major focus. Absolutely, certainly. But then, if you look at other social vulnerability indicators like poverty, then it's it's not the same story. So I think everything comes together, and I think maybe a good counterexample is that the heat map actually shows the Upper East Side actually in the morning is just as hot, if not hotter than Harlem, for example. But the thing is, people in the Upper East Side are more likely to have buffers against extreme heat. So, they're more likely to work in climate controlled offices, or, they have better access to healthcare. So we think that, we can't just look at things like green space and tree canopy, but also, like, for example, if you look at housing that people live in, if your housing just absorbs and traps heat and you can't recover from it at nighttime, it's great that you can go to a green space during the day, but then if you can't recover from it at nighttime, how good is that? So we're not trying to put a specific weight on one factor more so than others. We're trying to look at everything holistically.
I mean, the Upper East Side is extremely dense, as except for Central Park, but within the Upper East Side itself, there isn't really that much parkland, and I should say that I know this directly because I also work for the Parks Department, and so I deal with this issue every day. And as long as I'm admitting to working for the Parks Department, let me also report that in boards 9, 10, 11, and 12 are target areas for our tree planting efforts. And since 2015, we've planted almost 1,000 trees, street trees, in Washington Heights and Inwood. And this particular year, we intend to plant another 160. And we're going to be planting hundreds more as well in the 3 districts in Harlem. OC, you have a question?
Yes, I do have a few questions. I just want to mention that something to look into is the highway. The reason why the South Bronx has the highest, or used to have the highest,
Right.
asthma rate is 8795 created triangle. And so no matter how the wind blow, they get, the junk coming from the traffic. So we have that.
And what about us with the
Nine-
cut? With the cut?
If you let me continue,
Okay,
I'm just going to say that.
Okay, very good.
95, yes, on 179th Street, 95 is cutting our neighborhood.
Right.
And this is the area that we'll need to pay more attention to. I know that the Department of City Planning has some lots, like kind of air lots, I should say, that are up for sale for developers. So you can cover part of the highways, but this is not visible just yet, because as long as we are driving gasoline cars, you will need the towers to deal with the pollution. So it's not yet the case. But once we are running mainly on electric cars, that will be more feasible to build those highways. But then again, the pollution will go down with that. So the highways is a major, major contributor. And you're right, the trees, we have more parks than anywhere else in New York City. However, the highways is a really big problem. With that, I want to mention that I think the city, or maybe you at Columbia, can really push to start moving to permeable surfaces. The roads, the sidewalks should be more permeable, so at least some of the heat is being absorbed by the surfaces. Clearly not all of it, but at least some of it, and really concentrate in the area where next to 95, next to 87, Major Diggin, all those areas. So something to really push the city. And Steve, you're looking at me like you're not sure what I'm saying.
No.
Another thing is to look at how we're heating our homes, or how are we cooling them. So Columbia, again, had a really major geothermal study back in 2012-ish, I want to say, where you guys mapped the entire city for geothermal technology. So maybe bring that out, start to, talk to not just us, but talk to city government officials and highlight that, because I know that NYCHA is also looking at air pump solution, right? So instead of using gas or number 2 oil, hopefully not number 6 anymore, they are looking at part of the electrification, they're looking into heat pump, the air heat pump. But we should look into ground heat pump as well, especially when you guys did the study. So the study is already there. The preliminary work is there. So Steve, I think we should maybe invite more people from Columbia to tell us about those studies, and how can we help them to help us to push something like that forward, specifically because of high rate that we have in our neighborhood. And clearly the Bronx as well. I don't want to, but we, on our community board, we more, we care about our neighborhood, and that's where we concentrate it. Other than that, yeah, that's what I had so far.
All right, very good. Janelle, I hope you're taking notes so that we can follow up with you on these studies that OC has referred, as mentioned. Catherine, you're up next.
Thanks, Steve. And thank you, Dr. Yoon, for the presentation. 2 things. One is, I know that WEACT, I think about 2 years ago, was also led some community conversations on the same exact topic. I'm curious if it made it into the report, or if there's I'm assuming there's a collaboration of some sort, but curious in terms of any findings. And then the second part, and you mentioned that it was a multi-year project, not sure until when, is the factor of rezoning, not just in Inwood, but also in the Bronx. So for example, right at the highway entrances, what was previously warehouses and, train yards for us and I would say equally so for the Bronx, are now going to be towers, where people will be living. And curious, if that's part of the report, and of course it affects us, but even more so I could see on the Bronx side where, we have all these big towers blocking on our end, on their end. And I would imagine, the heat effect and impact that it would have on the other side of the river. So I'm curious, is that part of the report? Are there ongoing studies in that area?
Yeah, thank you for both of those questions. So first of all, the first part about REACT's findings, I think they are constantly doing really impressive work on extreme heat. And I think they're actually also targeting addressing indoor heat, which is a huge problem. In terms of the specific report you're addressing from 2 years ago, I'm not sure exactly which one, so I won't pretend like I know. But I will say Sonal Jessel is doing and leading a lot of work. So that might be a good person to look up. For the second, the rezoning question, I'm really glad you brought that up, because that's one of the reasons that South Bronx Unite and we got to work together. So their interest in this project was through specifically the question around that rezoning around their water space. So, as you know, the South Bronx is a peninsula, and that they happen to only also be the only part where people, being surrounded by water, they don't actually have access to that space because it's been zoned for development, for condos, or otherwise it's cordoned off for industry. So they wanted some to gather data to show that this has impact, and they're now using this data to advocate for themselves to say we actually there's a lot of reasons why we need access to this green space. So South Bronx Unite and we are collaborating. I mean, they own this data as much as we do. So I'm not sure exactly who they're talking to or what they plan to do, but rezoning is one of the biggest rationales for their motivators for doing this. Dr. Christian Branyan has to go soon, so I want to make sure that he gets a chance to speak. Oh no, maybe he's already popped off actually.
We lost him.
I think so. Okay, that's okay. Okay, so yeah, I'll leave it at that maybe.
Okay, all right, thank you, Sally.
Yes. The WEAC stuff, you're correct in that we're continuing to work on it. There's a climate justice working group that we might have just changed our name, but we've been working on.
I was a part of it actually. Yes.
Yes. The study showed the same thing. I mean, y'all just confirmed what they had done from those preliminary work. The question that I have is sort of for Steve too, and for anybody, is that Inwood's been designated, and that was the advisory group that Peggy led for whatever the mayor's office on sustainability or whatever that was supposed to be, and we are a designated environmental justice area. And I wonder how these things that y'all found and that we knew, but y'all have now quantified, how they can be translated into getting justice for these areas in terms of trying to mitigate some of these problems. So that's my question.
Yeah, I appreciate that. That's also, I mean, that's one of the, so maybe I can talk about the different aims that we have. Like I said in the presentation too, people already know which areas are hotter. We can't just keep confirming the same findings. What we wanted to do more so was, to connect the dots. Why are these areas hotter? What are the legacies that remain from historically discriminatory policies? And also, how does this connect to existing health disparities? And that kind of work, the connecting the dots hasn't worked, hasn't been as prominent other than compared to, showing which areas are hotter. So we're making like an online story map where you can look at all of these factors together and see these overlaps, where I showed you multiple maps and show you the overlaps. We're trying to make something interactive where you can see that these are not coincidences. So we're hoping that that kind of novel approach has an impact. We're also, so Christian Branyan and I are both members of the New York City panel on climate change. Christian is actually one of the co-chairs. So we're working on the next assessment, and we're also in talks with people at New York City Department of Health and Mental Hygiene.
Right.
And we are aware that they already have equity-oriented approaches and initiatives to this, but our data, because our data differs from existing satellite data in that we looked at street by street differences, so it's a lot more granular.
Yeah.
So this can make their approaches, existing programs, more targeted. So these are some of the.
It really is climate redlining.
What's that, sorry?
It's like climate redlining. I mean, y'all document.
Yeah, well put, exactly. Yeah, so we're trying to make these things more tangible, not just make it about heat, but say it actually matters that people will have less access to healthcare in these areas. It matters that people are more exposed to air pollution in these areas. That just coloring, painting rooftops white isn't going to fix things. We're trying to make these connections.
Well, thank you so much. I hope you continue to visit us every once in a while. This is fascinating.
Yeah, I second what Sally just said, but I'm wondering, do you have data that is, I think you do, that you have data that's specific to block by block, where we can zero in on exactly which blocks have the worst heat problems?
Yeah, so in our story map, you'll be able to zoom in and see the color gradient differences. It won't, I guess you can assume what the degrees are by the color gradient, but yeah, our hope is that this will be a granular map. We don't have that available yet. We're hoping for a summer launch, and we'll let you know when that's available.
Oh, that would be fascinating. So there will be like an interactive map that you'll publish on your website that we can look at?
Yeah, exactly. I mean, let me not overpromise. It's not like you're gonna go to like one intersection and it's gonna pop up exactly what temperature that was on that day. Like this is based on an algorithm that Kappa Strategies developed. But our aim is to make something interactive that connects the dots. Yes.
Well, and let me ask you, wearing both of my hats, do you think this would be something that would be helpful in guiding our tree planting efforts?
Oh, absolutely. Yes, of course.
Right.
Yes, I
All
hope
right.
so.
Yeah, it seems like it should. All right. Well, I certainly want to stay in touch with you. So thank you very much for coming, and I apologize to Christian that we didn't give him a chance to speak.
Steve, I have one
Steve?
quick question about the trees.
OC, hold on.
Okay.
Emily, you.
And Allegra has a question.
Is Allegra with us? Oh, great. Emily, go ahead.
So sorry, y'all. I was in a union meeting, so I did miss a large portion of this presentation, and I was really interested in it. So I'm so sorry if I'm like being redundant for this question, but I did see, like, when I was doing internship work in 2017 for REACT, that they had a Northern Manhattan climate action plan that involved solutions, like climate change solutions in Northern Manhattan, at least, especially for like heat issues. So I don't know if you're like working with nonprofit, just organizations, grassroots organizations, any kind of organization local in the area to, I know that you were talking about a system, so I don't even know if this is far off from what you were talking about, or if
I appreciate the question. Yeah, so we certainly don't want to be, nobody wants to reinvent the wheel. So absolutely, South Bronx Unite, us and REACT, all of us are in touch. I know Sonal, I've also been a member of REACT. I will say I'm back in Canada. I'm Korean Canadian. I did my postdoc there, and then I'm now back here, and I've actually moved to a different job. So I'm not completely certain on what the plans are going like past the summer. Like I'm going to be involved until the end of the summer, but certainly Dr. Christian Branyan will stay on. And I know that he also has a relationship with REACT, but also as the co-chair of the New York City panel on climate change, he has a lot more connections. So yeah, I think the hope is that there will be synergy amongst many.
Thank you.
Of course, thank you.
Good. Could somebody please? No. Hello? Okay, Allegra, go ahead.
Sorry, that was probably my house. It's crazy in the evenings with kids. Yes.
Hold on
So,
one second. Allegra, I want to thank you for suggesting that we reach out to Dr. Yoon to arrange for this presentation. This is Allegra is the one who suggested this in the first place.
Oh,
So I thank you very much, Allegra.
yes. Hi. Thanks for coming to my local community board.
thank you.
So my question was, I'm glad Steve asked about the block by block level, because although community board 12 on the whole looks great, there are really steep gradients, and you can, for instance, if you go across anything north of 200th Street, you go from this forested park to on the west side to old landfill on the east side, and the fill-in Dutch style tends to have much bigger urban heat island kind of impact, which is glossed over, I think, in the averaging. But so I think definitely doing more block level will be interesting. My question is, competing interests of addressing climate change and urban heat islands. So the Lower East Side Park has been in the news a lot lately because they have a project to raise the parkland there as this seawall kind of barrier by 8 feet. And a part of that work was cutting down a lot of the mature trees. The community was really worried about it. From a visual standpoint, it certainly doesn't look good, but do we have any information from a climate change perspective? My sense is that because the river is right there, there's not going to be such a huge difference in urban heat island effects, but you probably have a better sense for it than I do. So how do you balance these things out? Like taking trees out to raise the land and then replanting immature trees versus keeping the mature trees to address the urban heat island today?
Thank you for telling me about, actually, I didn't know that was going on. That's good to know. Though I have to say, I'm going to disappoint you a little bit. I'm actually a social scientist, and Dr. Christian Branyan is actually the climate scientist. So he would have had a much more informative answer, and I certainly don't want to make things up. So I'm going to maybe say, let's park that one for Dr. Christian Branyan. I can refer that to him and maybe have him get back to you. My gut instinct is that, I mean, I don't know who's making this decision, but if they've decided to do so, that there has been science behind it. I'm guessing also, if there's a risk of flooding and that, putting lives at risk, then that's going to be prioritized over planting a few trees. But I'm not sure what all considerations were in place before. So yeah, I'm going to say, let's ask Dr. Christian Branyan when he's available. Sorry about that.
All right, thank you.
Thanks.
And flooding was the original preventing the flooding was the original intent of the resiliency project down there.
Yeah.
But OC, do you want to go ahead?
Yeah, it's actually, Steve, it's something that maybe you can answer, or maybe just something to think about in terms of the parks department. We really have to think of what type of trees we are planting as street trees, because some trees may have like higher intake of carbon, ability of higher intake of carbon, as opposed to, it's just like different trees have different way of taking carbon. So parks need to look into it seriously, especially in areas where the asthma rate is high, and gradually take that and implement it throughout New York City.
Yep, I agree.
That's really, really, really important. Really, really.
I'm going to look into that. I haven't heard that point made before. Thank you. I'm not a tree specialist, but so I wasn't aware that trees will take in different levels of carbon. That's interesting. Makes sense, I guess. All right, so Dr. Yoon, did I hear you say that right now you're in Canada?
Yes, I'm back home in Canada.
Oh gosh, so are we going to be able to stay in touch with you?
I mean, yeah, you can reach me at my email anytime. Yes.
All right, great. All right, so it's not like you're disappearing.
No, no.
Okay, very good. Well, I certainly appreciate you taking the time and traveling all the way back to New York like this. And we appreciate the work that you've done. Thank you so much.
Thank you for inviting me. Have a good night.
All right, take care.
Bye now.
Oh, gosh. All right. Next on the agenda is our usual reports on COVID-19. The latest statistics, actually, as of yesterday, show that the positivity rates in our community have gone up significantly since the last time we met a month ago. But I mean, they're still relatively low. But last month we were at around 1% in each of our zip codes. This month or this week, we were running at a little over 2% in most of our zip codes and close to 3% in zip code 40. In the week ending on Sunday, there were 120 new cases. The total number of cases since the beginning of the pandemic, 47,345, 569 new cases since we met a month ago. Total deaths are 921, 9 more since we met a month ago. Our vaccine rates are still just barely increasing. For one dose, we're running between 76 and 81%. People fully vaccinated, we're at 79 to 72%, and we're significantly behind the rest of Manhattan and the rest of the city. In fact, this is an issue that I raised yesterday morning at a meeting I attended of the Presbyterian Hospital Community Leadership Council. I mean, we just haven't reached enough people and convinced them that they need to be vaccinated. So the mobile vaccine van that we arranged with Dr. Karen Thornton, a local resident, is she's still stationing it outside Good Shepherd Church, Mondays through Saturdays, 10 to 4. This particular Saturday, she's agreed to put it up at 218th Street and Indian Road, so that people who are going up there for the Inwood Little League opening day ceremony might take advantage of having the van there. The Little League, in fact, asked whether or not the Little League reached out to the hospital to see if vaccines could be made available to people attending the event. And the hospital reached out to me. So I don't know what that shows. I think I do know what it shows, but the van is being provided by Dr. Thornton, and she's done an amazing amount of volunteer work in this community. Sally, you have a question? Sally?
Sorry, I was on mute. Can we get either Test and Trace and Dr. Thornton or someone with vaccines to come on the 23rd of April from 11 to 3 by the farmer's market?
Yeah, I have suggested that to her in the past. Why on that particular day?
Well, because there's the farmer's market is there. We're doing a big sustainability zone for Earth Day.
Oh,
And there's millions of kids and people are coming in and out of the park to play baseball. It's a perfect location.
yeah,
It's very, very high traffic.
right. Yeah, I have suggested to her in the past that on Saturdays she should move the van up to Isham Street to be next to the Green Market. So
Okay.
I'll talk to her about doing that again.
Okay, and also maybe the Test and Trace people can come and hand out masks and
Yeah.
sanitizer and that kind of good stuff.
Yeah, I've had trouble recently reaching the Test and Trace people.
Well, they've come out for Mulch Fest. They came out for last year's Earth Day. They've
Yeah.
been really supportive.
Yeah, All right, well, I'll try again. The guy that who had been coming to our meetings, I think, is no longer with them.
Okay.
But yeah, I should have tried reaching them before today's meeting. All right, good suggestion.
Thank you.
But we now have our reliable representative from the New York City Department of Health and Mental Hygiene, Pauline Ferranti.
Hi, everyone. I apologize. I'm on my cell phone because my laptop does not work. So I hope you can hear me okay. And so just in addition to your report, Steve, we are encouraging people who are eligible for their second booster shot to go ahead and take that. That's for people 50 and older, and those who are also immunocompromised. So if you're 50 plus, or if you're 12 and older and are immunocompromised, or if you're 18 and older and received the Johnson & Johnson vaccine and a booster, you're all eligible to receive a second booster. So we are encouraging everyone to go get that because, as Steve mentioned, we are seeing cases increase across all groups in New York City, but the highest case rate increase among those 25 and 34 years old. Again, we're encouraging everyone to continue following the Core 4 guidance and to get boosted when possible. There have been a lot of questions about masking for children under the age of 5 in childcare settings, and currently the mayor postponed his he stated that he wanted to make that optional for children under 5 in childcare settings on April 4th, but because of the increase in cases, he is reevaluating that. So currently, anyone who is 5 and older in school, it's optional for them to wear a face covering, but anyone under the age of 5 in a childcare/school setting, they're still required. And that's mostly because children under the age of 5 are not yet eligible for the vaccine. So those are my COVID updates. And then I have lots of news to share with you all. I don't know if you're gonna find it as exciting as I hope you will, but I did get information with regards to the scaffolding around our building at 168th Street. And so it is a capital project that is for major exterior renovation in coordination with the Department of Design and Construction. And the scaffolding was erected due to safety issues because we need to reconstruct the envelope and the roof of the building. It is slated to begin fiscal year 23. So it hasn't begun yet, which is why people have not seen any work happening. But the scaffolding did have to go up due to safety reasons. So again, our team knows about the concerns in the area, and we have asked just to make sure to check on the lighting situation. If any lights go out, that our team fixes that right away. And then we've also asked our health police folks to see if they can be a little bit more visible from the exterior of the building, if possible. And then we will also reach out to the precinct to see if maybe the NCOs that cover that sector would have more of a presence just, on foot patrol around the entrances to the subway, just so people feel a little bit more secure under that scaffolding. So that's my update on 600 West 168th Street. Are there any questions on that?
Yeah, Pauline, are the health police, are they there at night?
So they are there as long as there are people in the building. So depending on how late the staff stays, there will be someone there technically. I don't know how long or what the hours are. I don't believe they're 24/7, but I can double check that.
Just one more question before I turn you over to Sally and Ozzy and maybe Allegra. On the booster shots.
Yeah.
It's people who are 50 or older. And did you say people who are 18 and older and who are immunocompromised?
So you can be 12 or older with immunocompromised with an immunocompromised system. And then if you're 18 and older and you receive the Johnson & Johnson shot and a booster, you're eligible for that second booster.
The Johnson & Johnson shot.
Yep.
Okay. All right. Very good. All right. We also have 4 participants. Oh, hold it. I see. Okay. Forget what all right. Sally, go ahead.
Okay, this is on a totally different subject, but I'm trying to find out more about how the Department of Health is involved in the mayor's sweeping of the subways, his disappearing of the homeless encampments. With regard to the latter, I guess they cleared 200 plus sites and only 5 people were connected to service. So I guess I want to understand y'all's involvement both in the whole operation and then also what kind of data is being collected to show the effectiveness, or rather the lack of effectiveness of his approach to the city.
Yeah, that's a great question, Sally. Let me get back to you on that. I do know that as part of this Mayor's Subway initiative, he did utilize some of our staff, especially those who are clinically trained, to be able to assist in that effort. I don't know what the data collection looks like, but I am more than happy to find out and I can report back at our next meeting.
Thank you so much.
All right. OC.
Yeah, I just want a clarification. Is the address 600 West 168th Street is the bridging that is on for like 10 years or so, right on the corner where the subway station is?
Yes.
Okay, so for 10 years, getting exemption from the Department of Building to have that, or maybe paying the fine, I don't know. Paulina can.
Yeah, I don't know exactly how long that scaffolding has been erected, but yes,
we know it's 10 years.
Oh, okay.
Yeah.
Okay, so the last 10 years, I mean, I'm assuming it's because of, funding for the project and the allocation for the funding for the project. And then also, the scaffolding does have to be erected because of the safety issues. So I don't, I can't speak to why it's taking so long. I apologize.
Can you find out why it's taking so long? Because 10 years seems to be a little excessive.
Yeah, I'm happy to go back to our team and see why it took so long, but I'm assuming it's around the allocation of funding.
I'm extremely interested to know how you get exemption like this from the Department of Building. That's really interesting to me too. So if you can find out, that will be awesome.
No, it's another city agency.
No, I just but she's a representative. Maybe she can find out.
Well,
yeah, no, I'm more than happy to find out. I think, as long as the scaffolding is up, because there is a safety concern, I don't want to speak for the Department of Buildings, but I do know that there's a requirement for you to, check your exterior every 5 years. I believe that's what it is.
Every 4 years. Yeah.
Every 4 years. Yeah. And so, because there was no work being done, the scaffolding had to remain up. And so, the city is also paying for the scaffolding to be up, but I think it most likely has to do with a funding allocation problem, which is why it's taking so long for the work to actually start.
Let us know what you find out.
Will do.
Thank you.
And
You're welcome.
And as long as you're looking into it further, if the work is beginning in FY23, can you find out the anticipated completion date?
Yeah, so I asked about that and they don't know yet. So I believe once, they do that assessment and start the work, they'll be able to have a better understanding of what the timeline looks like. And so I will definitely keep you all updated on that as well.
All right, Jay Mazer.
Thank you. Steve, I know you've addressed this issue twice before, but I'd like to know why the wastewater studies going on.
Oh, yes. I do have an update on that, Mr. Mazer.
Okay, Pauline has an answer.
So yes, I was just gonna, have the questions about the building first, and then I'm more than happy to go into the wastewater topic.
Go ahead.
So we actually had a joint, I believe, hearing or a city council hearing with DEP last month, where a lot of information was shared, and I'm sure you can find the actual hearing on the city council website. But essentially the wastewater pilot is new, and we didn't publish the findings or make it public because we still aren't quite sure what to do with that information because it is new. And so we're just working with DEP. They handed us that information and data, and then we sort of on our end were seeing whether or not the data from the wastewater correlated with what we were seeing clinically in the clinical or testing setting. And so what was found is that we currently do have, a robust system of surveillance in terms of utilizing other ways to figure out what the case and transmission rate of COVID-19 is in the city. But we are very excited about this partnership with DEP on the wastewater. But as of right now, during the pilot, we saw that trends in the water match the trends in the clinical studies and data. And so we didn't feel like it was at this point, helpful to share the wastewater information just because we were still trying to figure out exactly what to do with that data. So I think it's still, since it is very new, we sort of are just utilizing that information for our baseline understanding of what we can do with wastewater testing in the future. But it's, obviously it's continuing, and we are happy that this initiative was able to happen. But at this point, we don't know whether or not it's a reliable indicator. And so that's why none of that information was on our website to share with the public, because we didn't want to cause, any confusion in case things, just weren't able, like, again, we're just trying to get the basic understanding of what we can do with this data. Does that make sense?
Yeah, I actually had a second question.
Sure.
Yeah, I have a follow-up question to yours.
But does it deal with the same subject on wastewater? Jay?
No.
Okay, hold your question.
Oh, right.
My question does have to do with wastewater.
Yeah, hold on a moment. Pauline, so I think what's been suggested in the past is that the data that's collected from the wastewater would give you an advance word on cases that'll be coming up in the next several days before they actually appear and present themselves. And are you saying that that's not what you found? That they don't necessarily give you an early word on the advance of a particular, let's say, Omicron or something like that?
Yeah, so what we found was that the wastewater surveillance data was consistent with clinical testing data. And while it was useful in confirming what we were seeing across the city, it didn't have the precision, and generally it lagged behind the data that was provided through our primary surveillance systems, like testing from the labs. And so it wouldn't, sort of preempt like actual testing in notifying us about any types of variants or, a surge in cases, for example.
Oh, okay. All right, because I've been wondering all along how precise you can pinpoint where the wastewater is even coming from, so you would know where the cases are developing. All right, Allegra, are you on the same subject?
Sure, I can ask some about wastewater monitoring. So right now we're talking about how you can validate, how you can distinguish between one person shedding a whole lot of virus or 100 people shedding some virus, and whether it varies amongst different variants. Columbia has been monitoring its own students, and Columbia has specific actual PCR surveillance testing of its students. And I wonder why these two data sets aren't being used to inform New York City decisions, because I think our current, like as she said, primary monitoring system, which is the citywide surveillance, now that there's proliferation of at-home testing, it's going to be strongly biased towards only testing very severely symptomatic cases. So a system such as the surveillance that's set up within the Columbia campus is probably more appropriate for having taking the pulse on how prevalent the disease is in New York City. And as long as you're trying to do, these seminal works on how wastewater prevalence correlates to disease outbreak, why they're not mining that data coming out of the student residence halls and their own surveillance.
Well, I don't know. Is that a question for Pauline or for Columbia?
Pauline is their representative. She should answer for them.
No, Pauline is the health department representative.
Okay, New York City Health Department, how aliased is your monitoring when people are doing at-home testing that's not reported? And do you have any surveillance monitoring that's superior to what Columbia is doing, which is, probably about 2,500 people a week, which is great for a population of 10,000, like however many people are around Columbia's campus, but probably not sufficient for New York City. So does DOHMH have any kind of surveillance monitoring that's not going to be strongly biased by people going out and seeking those PCR tests as opposed to at-home testing kits?
Yeah, that's a great question, and I'm happy to find out. I don't know off the top of my head.
Okay.
Every question is great, has no answer.
All right.
Well,
Jay, is that a new hand or an old one? Oh, no, you had another question. Sally, are you on wastewater?
Yes, I am. Just what Allegra, I was going to bring up the point that Allegra just made, which is as we do more home testing and those results are reported nowhere, how reliable can we even hope to believe that the student data is on positivity?
Right. I don't know. And that is a great question. And I usually try my best to come back with answers. So I just wanted to put that out there. I don't know, and I'm happy to find out. But it might change how we utilize the wastewater collection samples, right? If we don't know, and if it starts to not be as compatible, or it doesn't show that it's as consistent with clinical testing data, that might be a way that the wastewater might be more helpful moving forward, since there's a lot more home testing and not clinical testing.
All right, very good. Okay, Jay, back to you.
I was just wondering, there's already the figure of COVID deaths, but how does that correlate to the elevated figure of deaths over expected deaths or unexplained deaths compared to previous years, or compared to expectations based on COVID deaths, and how does that relate to COVID deaths?
Pauline, you have an answer for that?
I'm not sure I understood the question. I apologize. Can you repeat that?
Yeah, more people die than expected every year since the pandemic has begun. And that means there's an elevated death rate in the whole country. And one of the things that's reflected in is the continuing lowered life expectancy. How does that relate to the COVID death rate? Do we know?
I don't know. And I can bring this back to find out, but I don't know.
All right, well, I think that's a tough one.
Steve, I have a little bit of information that may help out for Jay's question. So in New York State, there are roughly 50, well, it's related, but it's not a full answer, Jay. There are roughly 50 people that die every day at home. Since COVID, there are 250 people that die, and I'm talking about New York State only, that die at home every day. So the assumption is that the 200 additional people that die every day since COVID are probably related to COVID. But this is only answering part of your question. The rest of it, maybe Pauline can answer next time.
Well, actually, that is a pretty good answer.
But it's not a complete answer. It's only those people that died at home that either were not tested or, you know what I mean?
All right, but it shows the, you know, shows the clear increase in the numbers of such potential deaths. And
Right.
obviously, we have an enormous number of COVID deaths. I mean, in our own community, over 900.
Okay.
Directly attributable to COVID. All right. Well, Pauline, you're going to stand by, I assume, in case
Yes.
something else develops.
Yep.
Okay. Jay, is that a new hand or an old one?
It's a new one.
It's a new one. But by the way, did I don't think anyone has wished you a happy birthday. Jay just turned 77.
Happy birthday.
Happy birthday, Jay.
Birthday, Jay.
I told him he's now joined Ed Kooky Burns at 77 Sunset Strip. So Jay is now so floored that we wished him a happy birthday that he no longer has a question. Is that correct?
No, that's not exactly correct.
Oh, sorry. Okay, go ahead.
I was just going to comment on OC's information.
Go ahead.
What she seems to be showing is a statistically significant relationship exists between the beginning of the pandemic and the elevated home deaths. And that is, as she pointed out, suggestive of elevated deaths than those listed officially. But it isn't exactly proof, as OC pointed out.
But it's clearly points in a certain direction.
Yes.
Okay. All right. We have an agreement on that. Very good. Next, I guess Julio did not join us, and he did send me some data on COVID patients. COVID patients at the hospital. So he reports that there are 152 COVID patients hospital-wide. 45 of them are in the Washington Heights Inwood facilities. Eight of them are in the ICU, and 4 of them are on ventilators. So let's move on now to Janelle Edwards, representing.
Steve, has Julio ever sent you the site data that I asked for a few meetings ago?
No, you're right.
We need to follow up on that. Okay.
Very good.
Hi, good evening, everyone. Sorry.
Can
Can you hear me all right?
Yes, Janelle, go ahead.
Okay, wonderful. Good evening, everyone. It's lovely to see you.
Janelle Edwards is the Community Affairs Associate for the Columbia University Irving Medical Center.
Yes. So I'm just going to provide a really brief report from the medical center. As I've been reporting, campus data has been available from the start of the pandemic regarding.
Janelle, I'm having trouble understanding.
Hearing?
Yeah.
Let me adjust the volume. Can you hear me now?
Yes.
Okay, good. My apologies regarding that. So as I was saying, the campus testing data continues to be available. As of the week of March 28th, 650 tests were conducted on the medical center campus with 14 positive test results. Across the entire university, over 2,600 tests have been conducted over the course of that week. Can you hear me all right? I hear something.
Yeah.
Okay.
You're breaking up.
I don't think that's me. There's something else. Okay, I think it stopped. Okay, I'll do my best. This week we wrapped up the final Community Health and Wellness series. This is part of the collaboration between Community School District 6, the Medical Center, along with NYP to cover health and wellness topics that might be of interest to students and their families. The final session was held today with Dr. David Albert, who is a dentist, and he covered issues and concerns related to teen smoking, vaping, and hookah. All of these sessions are available online. So if anyone is interested in watching at their leisure, the link was included in the report, and Steve will share that with you. In terms of some things that we've had going on campus, earlier in March, actually, but after my previous report to you in the March meeting, the Centers for Medicare and Medicaid Services Administrator, Chiquita Brooks-Ashore, visited the campus and had a meeting and discussion with elected officials, along with the new CUIMC Dean Armstrong, regarding insulin and insulin affordability. The conversation was also joined by the head of the Naomi Berry Diabetes Center, co-director Dr. Robin Golan, with some input from patients to talk about ways to collaborate on insulin affordability. In terms of events that we have coming up, there is a grand lecture, Leahy lecture, that's happening on the 13th of April at 5 p.m. The guest is Dr. David Kessler, who's the Chief Science Officer for COVID response in the Biden administration. It's open to the public. Registration is required. The registration link is also included in the report, and we hope that some of you will be able to attend this lecture series. In terms of some news that we thought might be of interest to the committee, you can read more about the glaucoma screening program that was happening under the leadership of Dr. Lisa Hart, to screen for glaucoma, particularly at NYCHA housing developments. The study screened over 600 people, and it had been really effective at screening for early signs of glaucoma. There's also an article about genetic testing for Parkinson's disease, and really highlighting what you need to know, as April is Parkinson's Awareness Month. So if anyone has any information or other questions about that, please refer to the article that I included in the report. And that is it from my end. Does anyone have questions, comments, or concerns? Okay, I guess that's a no.
Steve, we can't hear you, Steve.
Oh.
We still can't hear you, Steve. Oh, okay.
Janelle, the lectures or the sessions that you're doing with School District 6 on various health topics.
Yes.
Do you have more of those coming up?
So there was a series that it began in the fall and it continued. There were 6 sessions. They took a break and then they began again in the spring. So the final series, the final segment of the series was today, but they're all available on our website and the Community School District 6's website as well. In the future, I told them that it's hard for committee members to attend the lecture series because it's on a Thursday at the same time that you meet. So I'm hoping that they will take that into consideration moving forward so that you all will be able to participate.
I appreciate that, but I was also thinking that it could be a vehicle to get the word out to people who may otherwise be resistant that they should get vaccinated. That even if the topic is about something completely different, that you would begin the session by saying, we're here, we want to promote your health, and the most important thing you can do right now to save your life would be to get a vaccine. And,
Yes.
and whenever you have an opportunity to get the message out, if you're at an event for whatever reason to give a lecture on any subject whatsoever, to me right now, the most important message is to let people know that for their own benefit, they need to get vaccinated because I'm very troubled by the fact that our community is lagging so far behind the rest of the city on vaccinations. It's a significant number of percentage points.
Yeah,
So-
I definitely hear your concerns about that. The majority of, especially the initial parts of the wellness series, they covered questions about vaccination,
Right.
and particularly in youth and adolescents.
I know, but my point is, you're going to have a workshop about vaccinations. The people coming there may already be inclined to get the vaccination. They already have an interest in it. But here you have an opportunity maybe to reach other groups and other people who aren't really tuned into the idea of being vaccinated. They came for another subject, but you have them. You have
Right.
you sort of have a captive audience, and you have an opportunity to at least get up there and say, I'm going to talk to you in a moment about diabetes. But before I talk to you about diabetes, I have to make sure you understand that the most important thing you can do right now for your own health and well-being is to get a vaccination.
Right.
That's,
Thank you.
that's what I would tell everybody right now who's doing any kind of a health program. All right. Well, that's Sally. Do you have something?
Yes, just a comment. April is also Organ Donor Month. In New York, unlike many states, it's a state that you have to opt in, not opt out. Most states it's opt out. So unless you say, I don't want to be an organ donor, if you lose a loved one, their remaining organs could be considered for donation. I wonder if Columbia, given especially that the Irving Medical Center is stressing their heart transplant programs, I wonder if y'all are doing anything for Organ Donor Month, or if that's something y'all could start to do in the future.
I can definitely ask about that, Sally. I do not have information about the Organ Donor Month efforts at this time, but I can ask.
I would be happy to work with y'all on that.
Will do. I will follow up with Steve. Thank you.
Yeah, and we don't need to go into detail right now, but Sally has an amazing, an unusual perspective on the subject. Let me just put it that way, and can talk about it on a first-hand basis almost.
Thank you.
All right. Thank you, Janelle. And you're going to send me your report, right?
Yes, I already sent it to you, and once I learn some more info about what Sally mentioned, I will send you an email.
Yeah. Okay. Sally makes a very good point. I mean, obviously, the hospital does transplants all the time. It's a recognized center for transplantation. Organ donations are obviously in the interest of the institution.
Right.
Okay. Next we have Diane Ashley representing the Isabel Geriatric Center. She is the Chief Marketing and Communications Officer for the MJHS Health System.
Hi, everyone. Thank you so much, Steve. Numbers are holding in terms of vaccination levels at Isabella. Roughly 90% of our residents are fully vaccinated, and we continue to educate, but obviously based on the data that you shared, Steve, running ahead of where the community is. 75% of our residents have already received their booster. As some of you may be aware, because we talked about it a little earlier about the second booster, now that that's been approved, we are putting together plans to be able to offer that to our residents as well. So we're now starting to get ready to do that. Other than that, everything is very much stable at this time. There's really happily not a lot to report.
All right, well, that's good. Well, and so obviously your numbers are helping us with the vaccination rates in zip code 40.
Yeah.
Right. So yeah, zip code 40 is in the second place among our 4 zip codes. Zip code 32 is at 81.12% for people with 1 dose, and Zip code 40 is at 78.78%, at least as of yesterday. So keep getting those people vaccinated.
We keep trying as I've mentioned before, we're not allowed to require it. Everybody still, family members still get to make the decision, or the resident, obviously, if they're in a position to make a decision for themselves. So we continually educate, and so it's a priority for us. So we keep pushing.
Okay, thank you, Diane.
Thank you.
All right, we now have our special guest from the New York State Nurses Association, Nicholas Artur, political organizer, and Jacqueline Vanacore, an organizer at the Columbia. Do you still refer to it as Columbia Presbyterian or as NYP/Columbia?
I think we refer to it as all of them, but NYP Columbia, yeah, same thing. Thank you.
Very good. All right, so Nicholas, take it away.
Yes, I'd like to introduce myself. As Steve mentioned, my name is Nick Artur. I'm the political organizer representing Columbia Presbyterian as well as Harlem Hospital. I want to thank you for letting me be a guest at your community board meetings. I really appreciate it. One thing we're trying to do at NYSNA is get more involved in the community. And we feel through the community board is that one of those many avenues. So tonight, we were supposed to have one of our RNs who actually lives in the community board, Beth Loudon, but unfortunately she tested positive for COVID and won't be able to join us. So we have Jacqueline Vanacore. She's one of our organizers at the hospital, and she could provide an update on what's going on at Presby.
Great. Thank you so much, Nick. And thank you everyone for having us come this evening. And actually, this is my local community board too. I live in the neighborhood, so I'm really looking forward, glad to participate tonight. Yeah, as Nick said, Beth, she's one of our members of our NYSNA executive committee, as well as the bargaining committee. So she's definitely going to make a point to be here on upcoming meetings, but just couldn't make it tonight. So yeah, I'm going to give a little bit of an overview of where we are in terms of our getting ready for contract negotiations. Also an update, I guess more of a progress report for the Allen psych units, and happy to follow up with any questions that there may be at the end that I'm not able to answer. So just to give a little bit of an overview of NYSNA at NYP Columbia. And again, I'm not a nurse myself. I'm one of the staff member organizers. So we represent about 3,200 nurses across all the sites. So NYP Columbia, the main building, Milstein at 168th and Fort Washington, the Children's Hospital on Broadway, still around 168th, Uptown at the Allen Pavilion, and then various clinics throughout Washington Heights. We currently have a 10-person, like I said, executive committee, bargaining committee that was elected this past fall. So brand new group, very excited for negotiations and to really ensure that we get the contract improvements that the nurses as well as the patients deserve. So their contract expires the end of this year, so December 2022. Currently, the nurses are in the process of really identifying what are negotiating priorities as we get ready for bargaining, which really still stem from, improvements in staffing levels, grids, ratios, enforcement mechanisms for those grids and ratios in conjunction with work that we're doing with the recently passed staffing legislation law, as well as what's coming up as a common topic, as you can imagine, winning additional health and safety standards for in our contract, as well as preparedness around health and safety standards. So, and since the beginning of the pandemic, there has been, high turnover, a bit of an exodus from the nursing profession. And unfortunately, that has not overlooked the NYP system. So we're definitely facing, some staffing challenges. I would say in the hospital, some of our primary areas, the emergency departments, the ORs, operating rooms, and labor and delivery units. Really, those are our primary focus right now. And obviously, all those units provide such a vital service to the community as well as our patients. We hope in future meetings, we could bring some nurses to give you updates in those particular areas. And, our goal is to start contract negotiations this upcoming summer. So a little bit, our contract expires in December. We want to start bargaining this summer. We plan to bargain right on site, hopefully, if we can, in person at the Armory or some location at the hospital, really to get the membership participation, as well as hopefully some community members and local elected officials. And, I know the nurses really appreciate, and Nick has helped to facilitate too, the relationship that we have. And so we want to involve you guys in this fight a bit, and really, continue the conversation around our negotiations and some of our bargaining priorities, because they're going to benefit everyone too. So I guess before if I move on to just a quick update on Allen Psych, maybe any questions or comments?
Well, I'm just wondering, when you say that your priorities include the emergency department, the OR, labor and delivery, would that include the ICUs?
Yes, I mean, of course, all of the units, their staffing priorities for all the units. I would say those areas, the emergency departments, ORs, and L&Ds are probably facing the most staffing crisis at this point in those areas, in those three areas. Yeah.
Staffing at the ICUs is okay at this?
It's hard. It's decent, right? And by law, the ratio should be the max, one nurse, maximum of 2 patients. It's about backfilling some of those positions as well. But I would say the ratios are a bit maybe better comparatively, not great where they should be, compared to some of the EDs and especially the ORs. There's been really high turnover in those areas.
I thought maybe it's old news or whatever, but I thought I remember that some of the nurses came before us at some point and spoke about how they were being asked to take care of too many patients in the ICU. That probably was much earlier on during the COVID period.
I do remember, if it was some of the other, it may be the same unit. There was a temporary ICU that was set up, and it was nurses from sort of different areas that were tending to those patients. But yeah, ICU, of course, is still a priority.
Yeah, there were. I remember there was one nurse in particular who said, "I was never trained to do this kind of work." I forget where they sort of drafted her in to work in the ICU, and she said, "I'm not equipped for this. I was trained to do." I forget what she was, where she was from. But okay. But it's good to hear that maybe something has improved. So yeah, tell us about the psych unit at Allen.
Yeah. So, just sort of, like I said, a touch base or progress report. And for those of you who are unaware, there was, I'm not sure the bed size, but a psych unit.
30 beds.
Okay, 30 beds, right. So 30 beds at the Allen Pavilion. The unit closed in the beginning of the pandemic, NYP using the auspices of COVID as I don't want to say excuse, but yeah, we need this bed capacity to help with the potential surge of patients. As many of you are aware, I'm sure we're involved in this pushback with NYP for a while, pre-2020, right? They were trying to close this unit to expand their spine center a bit. Obviously, the unit that existed at the Allen Pavilion served, some of the most vulnerable members of our community, mostly Medicare, Medicaid patients. So COVID was, a time where they were able to permanently close this unit. As a result, the nurses who worked at the Allen Pavilion were redeployed during COVID. There is a psych unit in Milstein at 168th Street, but it's really more private pay. Some work there, some went to the med-surg units, really as helping hands, and through that process received training for the med-surg units. I think back in 2020, unfortunately, either those nurses have now absorbed positions in med-surg areas, or if they've chose, to work elsewhere. It's something that our executive committee and members continue to bring up. And I think it was another participant sort of raised just, the mental health crisis that the city is facing too. And as these for-profit hospitals continue to close a lot of these units and service, it's really, a detriment to our community. But we are, I think that we've heard, and hopefully we'll have some updates, and maybe some other people in the community have heard as well. I believe that NYP is planning to open this year in Milstein at the adult site at 168 in Fort Washington, sort of this combination med-surg psych unit. It's better reimbursement. I don't want to say better quote, but for the hospital, right? Reimbursements for the hospital. The individuals that would be admitted to these units need to have a medical, to go to this unit. It's going to be a bit different than what was available to our community at the Allen Psych. And also, of course, it's an issue of distance too. This is a bit further south. But as we get updates on that, we can definitely share at this forum as well, but supposedly they're going to open up it's a combination med surge and, and a psych unit too.
And do you know how many beds it would have?
I'm not sure yet.
All right.
Yeah.
So in order to be admitted to it, you would have to
Have
an additional medical condition?
Yes. It's not just a psych unit.
Right. Okay.
Yep.
And would that medical condition have to be the principal diagnosis?
I believe so.
Well, then that is not a psych unit.
Right. No, of course. And the it's unfortunately.
That's outrageous. That makes me sick.
Yeah.
That's outrageous.
I know. And it is something, again, that our committee continues to push back against, and it constantly comes up for us on the labor management side too, but it's really such a disservice to the community.
And their other plan is to try and whatever bits of psych they have is to move it out to Westchester, I understand.
Yes.
They can't make money off of in New York City, they will move to Westchester.
Yes, and they have I believe their psych hospital is located in White Plains.
Yep.
Yeah.
I've been there.
And they're supposed to be using Gracie Square as well.
Yeah, and another piece of crap hospital.
So to repeat, the medical condition would be the primary.
I believe it's not. I can follow up definitely for more specifics. This is what sort of where we're gathering from nurses. That it would be a combination med surge and psych area, but maybe the medical condition to be the primary factor in terms of admitting. But I can definitely circle back for you, and I'm sure Nick, I can relay some information.
Very good.
Jacqueline, can I ask a quick question, if that's all right, Steve?
Who's speaking?
Diane Ashley.
Okay, go ahead. What? Sure.
You had mentioned that the shortage of nurses in those 3 areas, and certainly a lot of the news on our end is that nurses moved over to hospitals. So just interesting where you thought the nurses had gone, or is this the great retirement that left you?
I'm not sure. I guess moved over from here. Where did they move over from?
In other words, that a lot of nurses in the industry had gravitated toward hospital. So just a question, where do you think the nurses went? Was this great retirement, or where did they go that you're suffering the shortage?
Yeah, no, I think it's a combination of retirement. Others have left for lucrative travel offers across the country. Some are still based in New York City. Others that I have spoken to, it's also, to go maybe to more of an outpatient setting and not so much the acute care.
Thank you so much.
Yeah.
Okay. Jay, do you have a question?
Yes.
Go ahead.
I was wondering, first of all, in passing, you made a comment about for-profit hospitals, staffing problems. I was under the impression, at least in a formal sense, that there are no for-profit hospitals in New York, although they seem to do business in the same way as for-profit hospitals, and in fact have annual surpluses above their tax exemptions.
Yes.
But my question is really if you could quantify the level of staffing. Does it meet the now legal requirements of New York State? And what exactly are the required ratios, and what are the in fact ratios in terms of nurse staffing?
Right.
vis-a-vis patients?
Sure. No, and maybe Nick could help me out on the staffing legislative side too, but I will definitely, your first comment, right? Yes, that in New York State, there is no technically for-profit hospitals. It seems like though, with the profits that they report, it's pretty lucrative. And we always think that that should obviously go back into the patients and to the staff. So it's my understanding now the law, this is right, a brand new law. We're sort of building out the enforcement mechanism with DOH as we go on. Currently I can only speak for at Columbia, our executive committee, which Beth is one of the nurses that is a part of, are working with management counterparts to agree on grids and ratios for each area, for each unit, whether it's ICU, med surge, the emergency departments. It's my understanding that at this current moment, all ICU units should be at that one nurse maximum of 2 patients as it stands right now. Does that happen every day? No, there's realistic factors of people leaving, nurses being hired, come off orientation. So there's a bit of a transition process there. Right now, the areas that we're working on almost to have a negotiations or discussions with management, let's say, to present to the state what we think our grids and we think and the ratios too, it's a grid and a ratio as what we want to jointly propose to New York State. That's where we are now. But I would say, and also we do have contractual grids. Our enforcement mechanism, I don't think is the strongest. So it's always about the nurses on the local level in the units really holding their managers accountable to making sure we have enough nurses for each area. So it really does vary, but pre-pandemic to now, there is definitely more, I would say, just an overall staffing crunch. And Nick, I don't know if you want to speak more about the law too.
No. If I could just add, we are also working with 1199 in each of our individual facilities. So each facility is going to be different. I mean, if you want current numbers on where the staffing levels are at Columbia Presbyterian, we can get those for you. And as we develop our grids and ratios along with 1199 and Columbia Presbyterian management, we could also share that with you. I would just have to run it through leadership.
So you're still in the process, basically, of working out what ought to be the official standards,
Yes.
which the law allows you to develop together with management. But and then those ratios have to be approved, I gather, by the state health department.
Mm-hmm. We have a year to do that, to put those ratios together. The only ones that were mandated as of January 1st, when the law took effect, were the ICU units.
Oh, that's okay. Well, that makes sense, I guess. All right, so you have until the end of this year to develop those ratios. Okay.
Correct.
All right. Okay, that's interesting. Okay. All right. Do you have anything more to as part of your report?
I think that might be it. I saw OC had her hand up.
Yeah, actually wanna.
Oh, very good. Thank you, Nick, for helping me out. Go ahead, OC.
Okay. Jay mentioned the for-profit that you indicated before in terms of
There are no for-profit hospitals.
Wait a minute, but there was a mention that some section of some units are offered for profit. Is that right? And if so, is that the psych unit or other beds in the hospital? Because I wonder, like, if they're for profit, even though I understand there is no such thing in New York State, but if they are for profit, that means that they can't take tax credit on that.
Oh, maybe if I apologize if I misspoke. Maybe I was referring to the reimbursement rates for the Allen Psych Pavilion, Medicare, typically Medicare, Medicaid patients. For private pay, the hospital is able to get a higher reimbursement from seeing different types of patients. Just I think more of maybe
okay, you didn't mention for private pay. Okay, so that's for psych units or any.
Throughout the whole hospital, there are various patients who, at the higher income level, who can afford to pay their own way. They pay out of their own pocket. and they generally would then pay at higher rates than what the government pays through Medicare and Medicaid.
Right.
Or
that
their
I-
insurers pay higher rates, not
Well,
just the individuals.
that's
They
right.
have more general coverage.
That's right.
Right.
Steve,
That just sounds
I think
terrible
I can
for
answer.
one big thing. It just sounds terrible because I'm just thinking about community member from our community, Steve, that cannot afford the services, and somebody else that can, maybe not from our community, is taking a bed in our hospital.
Well, I think that's a legitimate question, and it underlies one of the great problems with the whole hospital system, and maybe as Jacqueline referred earlier, it's pinpointed at the Allen Hospital, perhaps by the spine hospital, because the spine hospital is bringing in all of these private pay patients from all over. I think from all over the country, and I think we didn't quite at least I didn't quite realize what the impact would be of the spine hospital when they first told us how they were bringing in 3 high-class doctors from I don't know, St. Louis or someplace. I didn't.
St. Louis.
We're gonna. Where was it?
It was St. Louis.
Oh, it was St. Louis. Oh, what? Oh, great. So I didn't realize what it meant. I don't think any of us did. Maybe when we first heard about this thing, sounded good. I didn't realize it was going to have perhaps a detrimental effect on other services being offered at the Allen.
So in short, this hospital is not serving the community where he's in. That's my point.
Well, I think right now you can certainly say that with respect to the psych patients. We don't have a psych unit that served many of the people in our community. But not exclusively. The psych unit, if I remember correctly, roughly 50% of the patients came out of Washington Heights and Inwood. But where did the other 50% come from? They probably came from the Bronx. I mean, they didn't come from out west someplace. They came from New York City, I'm sure.
Steve?
Yeah, Jay.
Yeah, I think the question I raised several months ago about the cash return on floor space comes into this question on the Allen Pavilion.
Yeah.
That is, the amount of floor space that the psych unit provides would provide a certain amount of cash return per foot. Now, if that same unit was used for spinal surgery, hip replacements and knee replacements, it will provide a better dollar per square foot return. And that's the sense, one of the senses in which the current nonprofit hospital system resembles a for-profit business, not even necessarily a hospital. It resembles the calculations done in a factory as well.
But the question is, their charter was to be a community hospital.
And
what they've eliminated are essential.
I was trying to explain what I thought was their incorrect thinking and how I agree with everyone else that it's detrimental to community needs.
Right. There are not enough services that they can bill to a psych patient. Talking doesn't pay. What pays is slapping on as many ancillary services as you can. You can do that with the hip patient. You can do that with the spine patient. You can't do it with the psych patient.
Well, look, we also don't have a trauma unit in the whole Presbyterian system in our neighborhood, which employs 3,200 nurses.
Now, well, we still have to. I've done a little bit of inquiry on that question. But we do need to pursue that issue that I think Ozzy first brought up. But we do have, did I hear somebody just mention, we do have a child trauma unit.
Yes, that was me.
Okay. All right, very good. All right,
Do
thank you.
we?
What? Yes, at Morgan Stanley.
At Trump,
Okay, and how many
I mean-
beds are there, Steve?
Oh, I don't know. But
Okay.
maybe.
One?
No. How can that be?
no, it's a full-fledged child trauma center
I can find out the number.
designated by
of
the state.
That
And
would
what
be
we're-
great, Nick, if you
What we're
can
looking
find
at
out.
now,
Okay.
I really appreciate that, because
we're looking at now what it would require at a state level to get that same designation for adult trauma and
Right.
whether the state would consider it.
Right, we need to review that.
or we're looking for a different hospital to have a adult trauma here in our district.
OC, we only have one hospital.
No, we don't.
What? We don't?
We don't have to have one hospital.
Oh, well, we're not.
Nothing wrong with a little bit of competition, you know?
All right, well, I don't think we can go back to the 1980s.
You don't have to go to the 1980s.
Okay. All right. I hold it a second. What happened to Allegra?
I think they fell off.
Oh,
She fell off.
No, she's there. She's raising her hand right now.
yeah, but oh, there it is. Her hand is all the way over there.
There it is.
Oh, there it goes.
Or is she back?
Hi, thanks, Steve. I put my question into the Q&A too to get the names right. I went to a very interesting seminar last week about machine learning at Columbia for the Data Science Institute, and Jason Adelman, who's a doctor at Columbia Irving, was there giving a talk about his research into patient mistakes and how things that you can do to mitigate against patient mistakes, how the things like the Epic electronic medical record systems, sometimes it lets you open one patient record, sometimes it lets you open 4 patient records. Anyhow, he's doing research into all those kinds of issues, and it has a real bearing on as we're discussing the patient to nurse or patient to doctor ratios. I think it probably is directly relevant. It would be nice to invite him to give a lightning talk here at CB12, or just to get see if he has something in his research that directly speaks to this question.
Yes,
Thanks.
Allegra, you keep coming up with good ideas. Yes, that sounds like a good one. Because really, I remember at some point I raised that issue. There was a state report about mistakes at Presbyterian, and I raised that at some meeting with them, and they told me how they were creating, I think, a task force, and they were gonna. But yeah, we never heard.
I think he's on that. I think he's on that task force, and they had all kinds of really interesting research, like stuff like babies in the NICU. If you refer to them like baby boy Jackson or baby girl Smith, there's a higher incidence rate of mistakes, and you can do simple things like calling them by their mom's name. So like Allegra's boy or Sally's girl or something like that. If you refer to them this way, you can reduce mistakes. Doing things that you do with kids with autism. So instead of having patients by like some random number, you put like a little stamp of a butterfly or stamp of a dragon or whatever next to their name. All kinds of really interesting research that has a lot to do with patient mistakes and how to attenuate them. And especially like this electronic records thing, which is, I think, a mixed bag of reducing mistakes and causing you to have more work. So anyway.
So you put his name in the Q&A?
Yes, I put his name in the Q&A.
Okay, great. Thank you. Thank you much. Okay. New York State Nurses Association representatives, thank you for coming by and giving us an update. And we expect to see you again in 3 months.
Perfect.
Or
Thank
whatever.
you.
That's, whenever you have something to report, you're welcome to come back.
Thank you so much, Steve. Thank you so much, everyone. We really appreciate it.
Thank you. Bye-bye. Good night.
Now, Nick, I think I found an old business card of yours. Did you, I don't know, did you work for an artist group at some point?
Yes, I used to be the executive director of the Association of Hispanic Arts.
Yes.
Many moons ago.
Well, I still have your business card.
Wow.
but I finally recycled it now that I found out you got a new job. Okay, thank you for coming. We're now up to old business.
I have old business.
Well, we're going to get to your old business in just a moment.
Okay.
After we deal with my old business. Okay, so I sent everybody the DEP service request. And Tanya, I hope you noticed that among the 10 most common complaints during the month of March in Washington Heights and Inwood, 6 of them related to noise. I also sent you the latest report from DDC on their construction project, the water main, gas main work in Washington Heights. And as you may recall, the original target date for completion of the project was the end of March, but it's now been extended by 2 months until the end of May because of, well, I didn't copy that. Apparently, there were certain unanticipated field conditions. There is no report on street and sidewalk cleanliness ratings. And Sally, what's your old business?
Okay, I have a few old business things. First, and I know y'all have handled this in the land use committee, but since this is an environmental issue, I thought that maybe we should also discuss it for at least a moment here, which is the 4650. I know that the decision, and also we're the people who know food justice. The decision I know has been made by the old city planning commissioner to let the fresh thing go through. Like I had no choice. I do think it's part of our job as a community board to still advocate for what is right. And what is right is to not block the light. So I wonder if we can introduce a resolution, I guess, at the either tonight and pass it or at the executive committee level to reiterate to the new commissioner that we think this needs to be looked at seriously for blocking light for landmark building, etc. So I bring that up as old business, but new maybe for this committee.
Yeah.
I also want to bring up.
Well, I think the land use committee is working on something. It's specifically dealing with this issue about the Fresh 2 program and the fact that that we're being told that the city planning director had no flexibility and had to just to approve that application to give them increased density on the basis of their having a so-called fresh supermarket. So I think there is going to be a resolution that comes out of the land use committee maybe next month that will deal with that question.
Okay, and then my other old business is the Lower East Side Ecology.
By the way, 1 second. By the way, what we also learned at the land use committee meeting the other night, last night, from the city planning staff person, is that over 130 letters was sent to city planning objecting to that project. So that's I think pretty significant to show the amount of concern in this community about that project. And I assume that some of those letters also came from people outside the community who also understand the impact on the park.
Did anyone mention anything about migratory birds?
I didn't read all 130 letters, but
no, at yesterday's meeting.
Oh, it's a meeting now. But you know, we weren't going over the project all over again, and our focus right now is on this question about whether about the city planning director having to automatically approve the fresh application, even though some of us feel that it wasn't really legitimate. And Sally, you have something about the Lower East Side Ecology Center?
Yes. As just to review for the committee members who might be new to this discussion, this committee months ago learned that we had gotten funding from our former council member for one of 2 environmental initiatives. This one directed to cleaning up your city, getting rid of graffiti, garbage, etc. And we agreed as a committee that that money should be used to sponsor e-waste recycling events in Inwood and Washington Heights. I've had a conversation with Christine at Lower East Side Ecology Center. She's waiting. I told her that I would send her a letter of agreement that basically said that the Inwood agreement, if it would include two locations, the main location in Inwood Hill Park and then a satellite site at the Dykeman houses so we can handle all their e-waste. And then the Washington Heights would be a location still to be determined. So we just need to follow up and get that through the executive committee. I just wanted to reiterate or have the committee reiterate their unanimous support for this usage of funds.
Did she say she would be sending us a revised proposal?
I'm sending her, yes, because I'm sending her a revised agreement of what our understanding is, which she can then easily sign.
So
It's just-
Sally, we're gonna have two
Once
events a year?
But I will send that to you in the morning, Steve.
Okay, but we can't really send her an agreement without having a vote by the executive.
No, I know. So it will be a draft agreement of what the terms are so that the executive committee has something to vote on next Tuesday or Monday or whenever that meeting is.
Yeah, all right. Well, we need to phrase it very carefully. So
Yes, I will.
all right, so I thought what we were discussing was that we didn't need to pay for the Inwood location because it's already part of her regular program, and then we would maybe expand to 2 sites in Washington Heights.
Maybe you and I can talk.
Yeah.
Because I figured it was just the 2 sites with the satellite, but you and I can talk before I.
Oh, no,
right.
I don't think we need to pay her to come back to Inwood. She does that anyway.
So my question back to Sally, are we gonna have two e-waste events in Inwood a year, like
No.
2 events a year, or they're gonna run at the same time, or what?
At the same time.
The same time.
I
There would
think
just be a satellite collection over at Dykeman houses, and there'd be trucks bringing it over to packing it up in Inwood.
I think it's better to have another an event every 6 months or so. But that will be much better, or at least, you know what, every 4 months, if we include Washington Heights, like maybe every 4 months have an event in one of those 3 locations.
They don't
Why
follow
not?
12 year because they don't do it in the middle of the winter.
But e-waste is year round.
Well, maybe you do one during the spring, one in the summer, one in the fall.
Right. That's it.
You don't have to do it.
You're not doing it when it's snowing.
No. Well, I don't hear.
No, that's what I'm asking.
Yeah, I don't hear OC saying that, but you could space it out.
Yeah, you could space them out, and then the point is to keep having them so people get to know that they're there. And if
Right.
it's only once a year, it's like, oh, I forgot about it. I can't. I'm out of town. It's just like, you know how it is, Sally. You need to get people into the routine of.
Well, I think Sally's motivation, I think, is also to say, not everybody can go all the way up to Inwood. I mean, we have a 2/3 of our community or whatever is in Washington Heights, and
Right.
It would be great to be able to do a successful event in Washington Heights if we could pull it off.
That's true.
Okay, and then I don't know if it's new or old business, but 2 other. I have one announcement, so I guess that's at the end. But the other sort of new old businesses, like all this rat problem, both with the open restaurants, but also whatever they call themselves these days, but also with like vacant lots. I guess there was just an article in Patch, which I didn't have a chance to read, a rat infested lot. So I wonder if that's something that we need to address in this committee.
Well, I mean, the city in that case is actually taking action. They're taking I think they're taking the property owner to court because he wouldn't provide access. And that lot was meant to be was supposed to be a development site. I think by the same group that's doing the building under construction at Broadway and Fairview Avenue. So I don't know what the hell happened. They never pursued the project on 187th Street.
Okay.
But I mean, we should ask Ebenezer or Paola is on the call, right? Whether or not the office has been getting an increased number of rat complaints. Paola, can you speak to that?
I think they're mostly on standby, but we can send an email to find
Okay.
out.
All right, and, all right, does that wrap up old business?
No,
Oh, no. Okay, Ozzy.
yeah. Textile recycling. I'm gonna bring it every month.
Well,
We said last month
Yeah.
that we need to ask, who's running it?
the Grow NYC.
Thank you. Which other, markets or places they run the textile recycling? So for those of us that can travel, have them the options to travel to other places to recycle textile. I don't understand why is
Well,
it,
have you checked their website? I'm sure it's on their website.
I don't think it is.
Well, check their website. I think it is.
Sally, did you find something?
Oh, I wasn't looking at the website. I've seen some else.
Yeah. I mean, look for the listings of green markets, and then it should show you which ones offer textile recycling.
Okay, can we ask them when and why first, why Inwood is not one of those that back open, and when are they planning on opening the one in Inwood and in Washington Heights, like all those farmers markets? Why is it not back in the neighborhoods that mostly need that? It's just like,
Well, I don't know whether it was offered previously at the Washington Heights markets. That's a good question, but I don't know. I'll ask again. Okay. Allegra, is that a new hand?
Yes, it's the new hand. I guess this is oldish new business. I would still like to see the Department of Health monitoring for tick-borne diseases in New York City parks. I know I've asked them about this before, and they're like, "Oh yeah, we get back to you," and all know that they will never get back to me. Tick-borne diseases are on the increase because of climate change. Working towards enhancing their ability to proliferate everywhere, including in New York City parks. The ticks that bear Lyme disease have been found inside New York City limits, and in the outer boroughs, those ticks do have Lyme disease when they have done the surveys, but they're all like university ad hoc here and there. There's no monitoring. We monitor for stuff like West Nile virus, which is much more rare. I'm not saying we should stop monitoring for West Nile virus, just that we should start monitoring for tick viruses.
Okay.
It's not ticks, just viruses. Tick diseases, not viruses. Tick diseases.
Yeah, tick. Okay. All right. Well, Pauline is still on the call, and I'm sure she has just made a note of it, and I'm confident that she will report back. Okay. We're now on to new business. New business is that the state DEC has announced that they're inviting public comment about another brownfield site at 408 West 207th Street. I think this is a gas station where there's a plan to put up an apartment building. So as we did with 4650 Broadway, I'm planning to invite the people who are doing the remediation plan for this site to come to our meeting in May. And we're gonna have to quickly turn it around because public comments on the proposal are due on May the 9th. Any other new business?
Yes, I have new business.
Okay, go ahead, Sally.
Yes, I would like to have Fountain House make a presentation at a forthcoming meeting on what kind of services are offered in the city for people with serious mental illness, and also be a chance for the committee to find out about some of the work that they're doing with the crisis intervention teams, et cetera, to make sure that the first response is someone who actually understands mental illness, not someone who wants to lock somebody else up.
Can we shoot for June?
Okay, yes.
Okay, very good. Any other new business? Ms. LeGrand, is that the old hand or the new hand?
Sorry, old hand and doctor.
Old hand and doctor, very good.
yeah, I have a question, Steve.
You hold on a second. We're still on new business.
You're on mute, Steve.
I was wondering what happened.
Doing this to me. Okay, what's your question?
Um, it was like the Safe Needle. I forgot the name of the organization. That
Corner Project.
Corner
Thank
Project.
you. That
Also,
gave us a presentation 2 or 3 months ago,
yes.
and I signed up for a visit, but somebody got back to me and then they forgot about me. So I don't take it personally. I'm just not sure that I have their email address. If you can forward that to me, or if you, I don't know if anyone else tried to get, a visit and weren't able or something. So maybe you can,
All right.
maybe I'm not the only one, my point. So
I'll go back.
Somebody else mentioned that they reached out.
I'm sorry?
That somebody else had mentioned, I remember, not from this committee, that they reached out, and I guess they haven't. I guess they haven't heard back. I'm not 100% sure, but they tried as well.
Okay.
All right. Well, you could try again. You want an email address to try?
Yeah, just to.
Okay. Well, I'll send you. I must have the email addresses for the people who came to our committee meeting. I'll send it to you.
Okay, that will be great. Thank you.
All right. You know something? I also asked them for information about the breakdown of the clients, where they were coming from, and I don't believe we ever got it.
Okay, so maybe we need to invite them for an update.
Well, I'll just send them an email and remind them.
Okay.
All right. All right. I think we may be ready to adjourn.
No,
No. Oh, announcements. Oh, excuse me. Sally.
yes, I have 2 announcements.
Well, let's hear the second one first.
Okay, the second one is that May 7th is the 11th annual Riverkeeper Sweep. And there will be 3 sites this year, actually. There'll be 2 in Inwood Hill Park, 1 at the southern Inwood Hill Park at the Dykeman Pier, where we've always had them. And then the second site will be northern Inwood Hill Park, Muscota Marsh, and the whole northern shoreline. I can send a link so we can include it in the minutes. And the second more exciting announcement is that April 22nd is Earth Day, everybody's favorite holiday. And Friends of Inwood Hill Park will be doing their 7th annual Earth Day Festival. We will be doing a poetry walk on the evening of the 22nd, and then the 23rd, we will have our sustainability zone where we will be doing all sorts of recycling, repurposing, recovering of cleanup, et cetera, in the park. And I will send a flyer when we have it. And then finally, on just being arranged right now, there will also be a cleanup as a partnership between Friends of Inwood Hill Park, Robert Jackson, and Fountain House, doing a cleanup on the actual Earth Day on the 22nd in Inwood Hill Park. So once I have flyers for all these events, I will forward them to be distributed to the community.
Any invasive species events?
Well, a lot of we have done like monthly smaller groups, because a lot of people, if they don't know invasives, they can do as much, they can trample over natives on their way to invasives. But yes, we will be doing some invasive species events. And there's also a number of opportunities to get involved in that with the Super Stewards group of of New York City Parks, Forestry, and Horticultural Division. And you can find those on their website under Super Stewards volunteer events. But we usually post all of those on our site. And I think there's one coming up maybe next weekend or this weekend. I think they're on Saturday morning because I'm signed up for it. Or Friday morning.
All right. Okay. With that, thank you. Actually, I have a question for Nick. Nick, could you come back? Nick, are you still with us? I guess not.
He is. I can see him on the list here.
Yeah,
I've walked away.
well, he may have stepped away, I guess.
Motion to adjourn?
All right, it's, what is it, 8:52? The meeting is now adjourned. Thank you all for coming. Thank you again, Allegra, for suggesting our presentation today. And thank you to everyone else who took the time out to join us. See you next month. Take care.
Thank you.
Thanks, Steve.
Bye.